doctor. I read a story in the media about a woman who we'll call Angela. She had a terrible injury in 2016. She was able to get a family doctor, as I was in 2018, and my entire family. And Angela was able to get the medication she needed for her injury and treatment of that injury for several years until her doctor retired, moved away. What that meant was she was in limbo. Her medical records were moved to the clinic that we have been talking so highly about, which is amazing, the Tantramar Community Health Center in Sackville. And that clinic operated. We followed the story. If you want to get caught up, you have to go back and hear how this started yesterday. A very exciting development. It started small. It started with just orphaned patients, as we call them, people like Angela who lost their family doctor. And she has been waiting for a call. And the clinic went from starting with just taking over orphan patients from two doctors last fall, seeing 150 people or so, to as recently as this spring, they've reported seeing almost 700 patients that previously had no primary care options. There is a hospital in Sackville Memorial Hospital. Its emergency room is open from 8 o'clock to 4 o'clock, 7 days a week. So you can imagine any sort of primary care you need outside those hours, you simply cannot get it locally. That's bad enough. But then you have folks like Angela, who once she lost her doctor, lost access to her charts, essentially. It goes into the system. And she was not able to get her medicine, which needed to be prescribed by a doctor. They were controlled substances for pain, etc. And this is the kind of thing where we simply can't have this, because Angela is waiting around for a call from this clinic, which is helping 700 people that didn't have primary care before. But now she is waiting, and many like her. And what the Tantramar Community Health Center is seeing is that the waiting list of patients is growing and growing and growing. So I want you to imagine what it is like if we do not put into practice and get plans underway for community health centers. The Charlotte County Hospital in Saint Croix has seen that contracting of the emergency room services. Thankfully, it hasn't closed overnight yet. There was an attempt to do that under this government. There was enough protest to make sure that didn't happen. Our hospital serves many. But what happens if we were to get to the point where it would be cut back, similar to Sackville, and you can't get primary care and you can't get a family doctor? Here's what it comes down to. The Sackville Clinic, the Tantramar Community Health Clinic right now, has said they have all kinds of dreams and visions. Again, this has been moving forward since last year. They currently have 6 openings for administrative staff, dietitians, therapists, etc. But the bottleneck, I'm sure you can complete this sentence. The bottleneck, when it comes down to it, is the clinic needs, say it with me now, more doctors and more nurses. So MLA Megan Midden is working on and has worked in collaboration with a university to create a nursing program out of the hospital and get nurses into the system there that can serve the hospital and the clinic. Again, things are moving along. There was a statement saying that the hospital is about 85% staffed, that emergency room, and then nurses will move on to the clinic to try to get it operating more than 3 days a week. But right now, the clinic it is only operating 3 days a week, with doctors seeing patients virtually. But the people's charts are there. They are waiting for more doctors and nurses. So this is an example of what I've been saying, where you have the political will there. You do have, I would argue, the money there. The government has been running massive surpluses every year, year over year. And again, as somebody who owns my own business and runs a corporation, that sounds good to have all this money in the bank, but it's actually not that great. Whether you're an investor or a business person, you don't want to have money sitting there. Money is meant to be invested. It's meant to be spent. It's meant to be put to work. And so what this government is doing, I don't understand. The New Brunswick Medical Society, and I want to talk more about this tomorrow because I'm already at 5 minutes, has identified 6 priorities that are required to overhaul the system. And what they are asking for is a $600 million generational investment, as Green leader David Kuhn calls it. We need a generational investment to fix our healthcare system. I hope I've been demonstrating to you that the ideas are there, the will is there when people come together, when MLAs work hard with Horizon and Vitalite. We can do this. But what the government did was increase spending in our previous budget by, okay, I just said the medical community says 600 million. The government allocated a raise of 1.6 million. So 1/600th of what is needed. Again, I'm laughing because you might as well cry. We can do this, folks. There was a $1 billion surplus 2 years ago alone. So if you're wondering how would we do this, is the money there? Healthcare is one of those things. Health is one of those things that you take for granted until you realize it's not there, right? And I've said it a couple days ago. Investing in the healthcare system it is an investment. It's not an expense. You can't think about this as, oh, it's going to cost us money. It's an investment in attracting more people to beautiful New Brunswick. People want to live here, but there is a bit of a balk that happens when they hear about how bad and how desperate the primary healthcare system is here. That's what we can fix, and we can do it together. So tomorrow, because I'm all about saying there is a plan when we listen to the people who make these decisions, I want to talk about those 6 priority areas that the medical community has identified. And one of them is to open 50 community health centers across New Brunswick. And I want Saint Croix to be one of those and be a voice at the table and kind of a loud advocate for our region to have the community health center we need. So more on that tomorrow. Thanks for joining. I haven't said this in a while, but follow on Facebook if you're watching there. Subscribe to the YouTube channel if you're watching there. I go live every single day, and I'd love for you to join my campaign, my efforts. So follow along. Find a link in the description to how to connect up. I want to be your MLA and work this hard for you and harder when it's my full-time job.